I think are there any amendments to the agenda, any additions to the agenda? Anybody? Okay, I'm hearing none. Okay, we'll start with the motion to approve the agenda. Do we have a motion to do that? Looks like
So moved.
Desi, Jenny shook her head second. Desi and Jenny make a motion to approve the agenda. Okay, all those in favor of the motion signify by saying aye.
Aye.
Any opposed? All right, motion carried. All right, we'll move on to item 1, which is the consent agenda meeting minutes from June 25th. Any amendments to those minutes? Do we have a motion to approve the June 25th minutes?
So moved, Sonia.
Chris, I'll second.
A motion and a second. Any discussion? All those in favor of the motion signify by saying aye. Motion, and any opposed? Motion carried. They're hard to do this online. Okay, so appreciate everybody making it. I know we're having more our meetings more often, targeting the third Wednesday, right, at 1 p.m. I believe, Angie?
Yep.
Yeah. Okay. With the intent to just improve communication, all of those things as we go throughout the year. And so we have item 2 are the financials.
All right, I'll get into those. They were in your packet, the July ones. Sorry, they just got to Angie on Monday. But on the balance sheet, you can see cash and CDs have remained fairly consistent. We're up to 12.1 million in cash and cash equivalents. One thing I would recommend, if the board sees fit, is to do something more. We have a lot in cash. You have over 9 million just in cash accounts. And while they are in a sweep account, so they're getting more than most checking, it'd probably be beneficial to put it in some type of investment. And obviously, we're going through transition with Brenda leaving and stuff, but even if that's putting another 500,000 or 1 million in CDs while those rates are still high and can get a return, granted, in doing it, kind of having, you know, what we've done before with assorted maturity dates and things of that nature, but that might be something the board would want to think about, just because we haven't really dipped down into the cash a whole lot. It stayed really consistent up at that 9 million. So it wouldn't be a bad idea to get more of a return on some of those funds instead of just sitting in the checking account. And at some point, maybe even diving into either fixed income or equity portfolios, things of that nature. But again, you might want to wait until Hunter and everybody's got a little bit more time to adjust, but just something to think about. Rebates receivable are increasing. The last couple of rebates received were a little bit higher, so the calculation has been adjusted as approved by Eide Bailey, the auditors. So they've been doing that. So total assets are up at over 14.1 million at the end of July. Accounts payable was a little bit higher. There was a lot, you'll see on the income statement side, there was a lot of activity for claims during the month of July. So they were higher at the end of the month as far as what was owed to Blue Cross Blue Shield for things done in July that the invoice didn't come in until August. But liabilities were just under 6 million. So we're still sitting at membership equity of over 8.1 million. So again, sitting in a good consistent spot, about 400,000 higher than last year at the same time, but really consistent overall. Income statement is on the next page. This year has been a little bit higher activity. As you can see, the year-to-date loss ratio is up at 98%. Last year at the same time, it was 90%. So it is good that premiums have gone up a little bit, but there's just been a little bit more activity. Again, this can all be due to timing of when claims are turned in and when people are going in and seeing things. But July was a very high activity month with a loss ratio of 105%. So more claims going out and being paid than premium coming in for that certain month. But again, overall, still under the 100%. So for the month, we did have a net loss after all the operating expense. And obviously, you're going to have one with a 105% loss ratio. You're going to be at an operating loss to begin with, a little bit of cash equivalent. So net loss of 360,000 for the year, but still in the black for year to date of just under 150,000 income year to date. But it's definitely been kind of a lost year with claims as far as that claims activity being a little bit higher year to date so far. But overall, still, like I said, in the black, and membership equity is sitting in a good spot, over 8 million. So there's not really a huge financial risk right now, but again, the one recommendation I would have is maybe to put another $500,000, $1 million into an investment that can give us a little more return while we have that kind of cash flow. But any questions?
Yeah, Nora, and I might be wrong, but I thought the board had approved a a portion of finances that if it reached a certain point that you would be working with SEEK to be able to invest those funds. Was that a one-time thing that we did for the board? Or did we actually set a policy that stated that?
If you did do a policy, you guys maybe did it without saying anything to me about where it was at, and it could have been something that was done in committee. I'm not sure, but it wasn't something, and like I said, with Brenna being gone and Hunter new to the role, it's not something I was told like, hey, we have this batch. So far, it's just been, I help approve when they come up for renewal, just giving the approval with Hunter or Brenna, who was at the time, to Kenna at the bank saying, hey, let's renew this instead of cashing it out. So that's what we've been doing so far. So if there is a certain amount that you guys will allow us to do, again, like I said, the transition with Brenna to Hunter and us not always having all the information might have been with some of that too, but in the past, it was always you guys approving, hey, let's do another portion in there, so.
Okay.
So I can go back in the minutes and check and see. I remember the conversation. I can't remember the details, honestly.
And so I don't know if it
Meeting
was
on
discussed,
12th.
but then no policy was ever made that way. Could be very
There was a meeting.
possible, but
Nora, there was a meeting on 12/6/23. It looks like a policy was put into the board policy manual.
okay.
You want to refresh, I recall the same thing. You want to, Keith, if you
So
got
what- yeah,
access,
what did?
what did it say?
It says the trust administrator and treasurer may administer the trust investment portfolio. The trust administrator and treasurer may invest up to 3% of the annual premium income in short-term fixed income investments. The NDPHIT board must approve all transfers of NDPHIT funds for investment purposes exceeding this policy.
I guess we'd have to see what earned premium. So is it annual earned premium is what it says, Keith?
Correct.
Based on that knowledge, what would be the dollar, what would be the amount?
Look and see if I can do it. And it's 3%?
Correct.
Yeah, see, I think we'd be over with the 3%.
Over the $500,000 rep?
Well, what we have in there now, because right now we already have 2.7, just under 2.7 in CDs. So anything over that has to get board approved.
Okay. Okay. All right, we want approval of the financial report. Let's, why don't we start there? Then I think we should talk about, additional funds being moved into an investment. We have a motion for approval of the financial report.
So moved.
Sound like Cole, Kevin is second, looks like. Any discussion? Any discussion? All those in favor of the motion signify by saying aye.
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 Any opposed? All right, motion carried. Let's talk, I guess, it's not really an agenda item, but it's connected. Do we have a recommendation on what we should transfer into an investment account?
So Mike, I have a question first on that. So I know we talked about that percentages, but what we do in the Park District here is we have all of our CDs listed with a termination date, so we know which ones are off and which ones are on. So do we know, Nora, which ones might be result or terminating out? So we don't have all of our cash
Yeah,
long-term,
Hunter
so we
would have
stagger
that.
it?
I don't have that information. That would be all at SEEK. So Hunter would have something like that. I'm sure he's got a listing. We just renewed one recently, but I know when we were doing them with Brenna, we scattered the different maturity dates for the interest rates and that kind of stuff as we were doing them. but I don't have the list of when certain ones are. Right now, we've just been renewing everything for a similar, like, so if it was a 9 month before, we're renewing it for the new 9 month as long as the interest rate is right, or if it was an 11 month. To try and keep that kind of scattered as it goes, but I don't know when the next one is. That would, Hunter, you might have that information.
Yeah, they're all kind of scattered throughout the year, but I do think the next one's coming up in the next month. But yeah, like Nora said, they just kind of been renewing at the same term as long as the interest rate. If I can send a CD ladder to you guys, if that's what you're requesting.
Well, what we could do is look at the listing when 100 is after this. If you give us, if you want us to put another 500,000 into one, we can kind of look at when they are and be like, hey, let's see what their 15 month rate is, because that would be a good timing when we don't have anything coming up, or we can look at it that way to make sure that it still fits within the pattern. So that, you know, every couple months or 2-3 months, there's something maturing.
Yeah, I think Hunter would be helpful to have just a list. I don't, maybe not when, how much in this bank and when it, you know,
Yep.
date is and all of that would be helpful to just to look at.
Well, to give some flexibility for investment, could we just do a motion? Are you thinking, Nora? I don't know if you and Hunter have had a chance to discuss up to what could be transferred over to make sure we have enough operating cash to pay premiums. Is 500,000 a realistic estimate?
Yeah, that, I think 500,000 taking out of cash would not present any issue for cash flow for payment of claims or anything of that nature. And we could always start with that, or if you guys want to wait until, since we are doing them monthly now, you want to wait till the September one, and we can, Hunter can have the list of maturity dates and stuff and amounts at the next one, and if you guys want to do it that one, but just something to think about moving another. Just like I said, while interest rates are still good in CDs, without getting into higher risk investment portfolio yet, but just to get more out of our money than just 9 million sitting in the checking account.
I would make a motion to allow Seek and Nora to be able to invest $500,000 into CDs. I think, yeah, who knows what rates are going to look like 30 days from now. So
I definitely second that. Sonia.
We have a motion and a second. Any discussion? Any discussion? Any discussion? Okay, all those in favor of the motion signify by saying aye.
Aye.
Any opposed? All right, motion carried. So next meeting, we'll have some information on that.
Get
September.
a list. We'll make sure we have a list of the maturity dates and everything at the next one.
Sounds good. Thank you. Moving down the agenda here, we have item 3A, which is under operational strategy, participation agreement change rollout update. As we know, we talked about this in June, and it went out to members. I think we had a few that were talking about leaving and going and other things. So we'll hear an update on that.
So we had the webinar, we got all of the acknowledgements sent out, we got the information sent out to all the groups. We did have some that had questions about if they were to leave just because of their circumstances. None of them chose to leave prior to that August 1st. We received the majority of the acknowledgements back. Anybody that we didn't receive an acknowledgement back, so Brown and Brown tracked that we had a read receipt on all of them. There were a couple that we didn't have an acknowledgement or a read receipt on. So I called and left very detailed message explaining that it goes into effect August 1st, whether you acknowledge it or not. And so reviewed that with the attorney. He said, then we also sent the ones that didn't sign the acknowledgement. We send a follow-up email to all of them that said same thing. Even though you didn't sign it, your continuation in the trust acknowledges that you're agreeing to it. So ran that all by the attorney, and he said that was good documentation. We have it all documented, so we have a spreadsheet with all of that information as well. So Having said that, it's kind of all wrapped up. It all went into effect August 1st, and now unless or until somebody questions it, it's all in place, so. I don't know if there's any questions, but we just wanted to kind of give an update that everything's wrapped up and kind of how we tracked everything, so.
I have something that's maybe kind of related, and it's just something to think about. As we get new administrators, and again, I'm just sort of speaking for the October pool for the most part, since it's schools. I just wonder if we should target new folks just to kind of onboard them a little bit. I had a new superintendent that reached out to me and was extremely confused about NDPHIT, and I tried to help them. So I think it's something that we should sort of go through our list, who's new, and then maybe it's something a few of us can schedule a Zoom and just talk about NDPHIT with them, so they have a better understanding about what we're trying to do and accomplish here.
I do that with the business managers, so like the new business managers, but you're right, superintendents, we don't even always hear about who the new superintendents are. Sometimes it's, all of a sudden something goes out and it's like, wait, I didn't get that. That's when we find out there's a new superintendent, or during the renewal call, sometimes they'll find out about it. I'm very quick to reach out to business managers, HR people, the new people that are kind of doing the day-to-day. And can certainly do that with the directors and superintendents as well, but it may be better coming from the board as well. So whatever you guys feel best, I'm open to anything, but we definitely do an onboarding with those ones that are doing the day-to-day functional. Some are open to doing it right away for training. Others are like, you know what, I've got 7 million other things I have to learn, so hold off and I'll get back to you. So I just leave it up to them when it works to do training, and then let them know that I'm there until we do that training, so.
Another suggestion would be too, Mike, would be, at the convention with the breakout sessions, like maybe even if we did it, if you reached out to our School Boards Association on the business manager side, and they could do a breakout session or in their meetings and kind of just plant that seed, for them to then, if there's somebody, so if the superintendent's hearing it and the business manager's hearing it, and they get back to the office on Monday and they're like, hey, we should look into this, or.
Glad you brought that up, Sonia. I was thinking that we definitely should have a breakout session at both of those, and I don't even, it's just sort of a Q&A. A few of us that are willing to that are there already, like, I'd be willing to put in a breakout session for both of those, and let's just, what do you have? What questions do you have about NDPHIT? And, just kind of, here's what we're trying to do with consolidation of plans down the road. And, here's what we're all about. What questions do you have? And so I was thinking about doing that too, but yeah.
Yes, I don't know if Angie, I know you do so much and I appreciate you so much, but I thought maybe that's something you could throw on your to-do list, is just to reach out to North Dakota School Boards Association and just plant that seed. And then you could throw Mike's name and my name out there saying that, if you want us to do a panel and a breakout, or if you just want me to talk to the business managers and Mike, do a breakout with boards and superintendents or whatever, just kind of get an idea of where they'd want to plug us and what, what we could provide.
Yeah, absolutely.
Thank you so much.
Thank you. That's great. Great suggestion.
And then on the county side of things,
Yeah, that's what I was gonna say. If there's,
I'm sure you have some get-togethers, right? Yeah.
Yep, and we've actually had NDPHIT come in and do some sessions at our conference before as well. And they also exhibit at our conference, which is helpful too. I don't know if you guys have exhibitors at your.
Well, and I think they do
conference.
that. I think Brown and Brown does that at the school board and different ones. I'm pretty sure.
We do
Yeah.
both.
Mm-hmm.
Those dates are coming up pretty soon. I can't remember, what day is the administrators, 16th, 17th or something like that? 17th,
Yeah.
October. Yeah.
Yep.
School boards is a week or two later. Can't quite remember. Okay. Okay,
I
well,
think school boards is before this year.
what's that, Kevin?
I think school boards is before this year,
Oh, okay,
the 8th or 9th.
okay, early. So maybe Angie,
We'll
you
see.
might
Do
connect
you
on
want me
that.
to see if they have room this year still, or do you think they have their agenda kind of set for this year, or does it hurt to try kind of thing?
I think those groups are always looking for breakout sessions.
Okay, perfect.
Now I know on the business manager side of things, there's the actual North Dakota Business Managers Association that kind of runs through the agenda for the business managers for the day. So I will reach out to them. Because maybe
Oh,
they could
okay.
at least squeeze it in their daily schedule, if we can't get an actual breakout session for the overall conference this year.
Okay.
Angie, maybe we can connect outside of here and let's get a
Yeah.
little bit of plan and
Perfect.
okay, we'll move on to item 3B, which is pharmacy claims audit vendor. I know there was a group that got together, scored the different vendors, and we'll have a presentation on that and recommendation.
So, kind of taking a step back from that, at the last meeting, there was like in the minutes, we didn't actually come to a resolution that we were actually approving to do that, to go forward with the process. So in the last meeting, it was decided that the committee would hear presentations from all three vendors, which we did. So the committee heard the presentations from all three vendors. And then there was an ask from the committee for references, and then also like the slide presentations. So I finished up the references this week. We also received the slide presentations from each one of them. So we have all of that information now to send to the committee and finalize their recommendation of who they want to select. But I guess the first question would be, is the board still moving forward on this? Because one of the questions, there was two questions. There was, do we wait till everybody's on the net results? For the pharmacy, do we wait till that change happens? And then the other thing was the outstanding question from whether Blue Cross was going to provide us access to certain things. So Stephanie had followed up with Blue Cross on that, and they're still very vague on their answer. They're not committing to it. But with two of the vendors, I know one of our Steph, maybe I'll have you speak to that a little bit more because you worked a little bit more on that piece of the puzzle, if you don't mind.
Sure, I'm happy to speak to it. So we went out to three vendors. Two of the vendors price their auditing services based off of the three levels of the audit that we're looking at. The first being rebates, which we know we can audit those because that's in our contract. And the rebates are new for this year. So this is the first time that either of the October pool or the January pool have been eligible for rebates. So we thought it would be a good idea to audit this program this year for the 2024-25 policy period for October and for the 2025 policy period for January to make sure that we're getting those and that they're being tracked appropriately. The other reason we wanted to do this is because we implemented a new plan design with the GLP-1s, and we did find that those claims were not processed correctly. They have since gone in and put in a fix, but we also want to audit that portion of it, of the plan design. The one area that we don't know that we can get access to is the financial contract that Blue Cross Blue Shield holds with Prime that specifies what the agreements are in terms of how the pricing of the drugs are paid, what rebates they're entitled to, et cetera. So the first two, the rebates we can audit. The second portion, the plan design, we can audit. The third portion that we're unclear on is the financial contract between Blue Cross and Prime to make sure that they're applying it correctly to NDPHIT's terms. So of the two of the three vendors price specifically for each of those types of audits. The third vendor, he has one set fee, whether we do 2 or 3 audits. His pricing is actually the most competitive. And he basically says, we will fight based off of the terms of your agreement with Blue Cross Blue Shield to get as much access to the financial elements as we can. So regardless of whether or not they get the full contract, they will do their best to get as much of the financial elements as they possibly can. So the pricing for them is the same, whether they do the full financial audit or simply fight to get the financials. So with that, I guess the question is, are we moving forward?
Right. So if we're moving forward, so the committee, we could do it where we provide the information to the committee, they review it, provide their recommendation, and we've done this before with other things where we do an email vote. It's not ideal, but just for the time sensitivity, we could do an email vote on it from the board to select the vendor. But today, if we can just approve the motion, whether we're going forward with actually doing the RX audit, because that was kind of in question at the last board meeting. We didn't have that motion and approval to actually go forward with it, so.
I'd put forward a motion that we move forward with the audit and we give the committee the authority to select the vendor. I don't like doing email vote. It just.
Okay, yep.
Okay, so Keith has the motion of moving forward, given the authority to the committee. Cole seconded. Any discussion? Any discussion? Any discussion? All right, all those in favor of the motion signify by saying aye.
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 Any opposed? All right, motion carried. Lost my screen here. Sorry, I'm getting it back. Okay. Item 3C is consolidation of plan design. That just an update or?
I'll talk a bit about that.
Okay.
In my section, if that's okay, Mike.
Yep.
So, do you want me to go ahead?
Well, we've got 2 items left. It looks like consolidation of plan design and market and legislative updates.
Yeah,
That's all Randy.
There you go. You're on the floor, Randy.
Okay, all right. Just let me bring it up here and we'll get to it here real quickly. I can find it. I think this is it here. Hopefully you can see this. Can you see my screen or my presentation?
It just shows that Randall Johnson has started screen sharing, but there we go. It popped in.
There?
Yep.
Yep.
Okay, hopefully when I do this, it works too.
Yep, that looks good, Randy. Yep.
Okay. So it's actually fairly short today, but a few items for update. So whoops, I got trends spelled there wrong, but plan performance, some RPM, this is the plan design, and then some legislative items that we'll cover. So this is, I showed this last time, but there are a couple updates to this. So this was the 2025 outlook for, this came actually up when I was doing an open enrollment meeting earlier this week with Hettinger. They asked about what they can expect for, the inflation trends or just cost. They always look at it as premium, of course. And I did spend a few minutes just explaining the concept that they have a zero deductible plan and a very low out of pocket. And I said, since the ACA was passed, these plans effectively been in place since 2010, and just think about what inflation has been since then. So the reason I went through that in answering their question is to essentially help them understand that it's unrealistic and unsustainable just by their basic plan that they have at zero deductible and out of pocket of $2,000. And the fact that inflation just in the forecast for 25 was 7 to 8%. This was earlier in the year. It just actually got released today by the Business Group on Health that they're actually anticipating the 26 inflation adjustment to be 9% overall. And it's driven by pharmacy predominantly, this increase that they're forecasting. These are employers across the country that they are surveying and looking at their actuarial data. The other element that is putting a lot of pressure is this section down here, the stop loss increases. Those are high cost claimants and pharmacy combined are really pushing these numbers for employers. And of course, NDPHIT's no stranger to this same problem. So just on high cost claimants, to give you some comparison, so I looked at 22, 23, and 24. Here's the interesting thing that you may want to be aware of are the claimants over $100,000. 17, 27, and 37% for NDPHIT. So this is the impact that's going to put pressure not just on our overall cost, but it's particularly on our stop loss. So this year, I think we've shared before, we got hit with a pretty high increase, particularly with the October pool for stop loss. But it's the number of individuals and the dollars combined that are pushing these, this overall cost increase. This goes back, and I'll get to in a minute, but this really goes back to RPM and plan design strategies, and I'll show you this some of our case studies. I think it was asked in one of the meetings not too long ago is, well, what do we have for data that we can show of what these type of programs actually result in by making these plan changes? And I do have an updated study that I'll show here in a minute. Here's the other thing to be aware of. So I actually looked at it by year and looked at, again, these pressures that are occurring, for what's occurring in the claimants over 100,000 and then just in the other categories of claims over 25,000. The bottom line is it's this year, it's only year to date, just so you know, on 25. So it's not a true accurate picture yet. But if you just look at the claims over 100,000 in 22 on average, on 23, 253, and then in 2024, 379. So you went from 196 for that category, 253 and 379. This year, I think Nora mentioned that we're having some higher costs than normal. It's actually a combination of the pharmacy as well as just, again, higher cost claimants in even those under the 100,000 have increased. So, and then this is the cost per employee as it relates to between the comparative of employee spouse, dependent. So you can see essentially, it's happening in all categories of those that are being impacted by the medical and the pharmacy that is increasing. But this gives you a little bit more breakout just if you look at the dependent or category by itself of dependent coverage or the employee. So this is, interestingly enough, in 2024, the highest category is the employee. Spouse is actually slightly down, and then dependents have gone up. And then this is just a update on plan performance. So these were just updated of data through June. So it takes us we get a month lag, and then so this data got updated for year to date, essentially for January. So this is a slight decrease in the number of members. So our contract size is changing a little bit, and actually it does in both pools. We just observe that just to say, okay, we look at members and then we look at employees that are on the plan. Then we look at the comparative of prior periods for the major chronic disease categories. The January pool has been somewhat consistent, but of course, obesity is actually, even though we have Digby and the other programs there, this blue line is again what's occurring in the current period. Then you look at the categories for where services are being rendered down here in the bottom left. A positive change in the inpatient for the January pool, but most other categories, particularly in these areas here in the middle, have gone up from the prior period. And the red over here is the prior period, and this mark here is the current period. So you can kind of see what's occurring in each of these categories. Musculoskeletal is up. The cancer cases are slightly up. Circular disease categories are up. So these are the major chronic disease categories. So what's occurring is again, as you have an aging population and you have certain chronic conditions, they get worse or they can. The current data kind of it reflects that for these major medical conditions that are occurring. Prescription drugs, Skyrizi pen, which is a major specialty drug area, has gone up significantly. The usage of Ozempic has actually gone down. Mounjaro is going up. And these two drugs, just on a reminder for the GLP-1 class that we have covered, these are diabetic classes. So it's not the weight loss or the obesity classification or non-diabetic. It's the diabetic class that we still cover. And then here's two other specialty drugs in that for a comparative purpose. This is the October pool. As I mentioned, just in this top box, the average contract size has gone down slightly by 2.5%. And then in terms of any change that's occurred in any of the utilization of chronic diseases, this one is a little bit closer aligned in terms of the number of individuals being treated for October. The inpatient down here in the bottom left, this is a big change. Now, I will say this one at the hospital, we do have an outlier. It's that high cost claimant that we've shared before. So that, and it also shows up here in this category right here at the top. Unfortunately, when they ran this report, it does not adjust for the stop loss level of over the 300,000. So this particular condition, again, it's an outlier, and I wouldn't give a lot of credibility to it because it's one case that's predominantly driving that. But then you could see just these other categories that are predominantly in what they call the major conditions driving cost for the October pool. And the interesting thing here, Humira pen. Now, I will show you in just a minute a slide shared with us yesterday on these categories of drugs that are occurring within our population that are actually in a positive kind of downward cost pressure, if you would. But just as, again, a snapshot of information there. Then the other thing that wanted to look at is the age classification, so when we look at high cost claimants, we look at age categories that also correlate to high cost claimants. And one of the ones that we speak to a lot is the age 65. I showed this because what I did want to demonstrate is that we started our program through the Medicare Choice Group a couple of years ago. At that time, we had 280 65 plus, It did actually increase slightly in 2023, and I think actually that's when we put it in place at the beginning of 2023. We went down to 285, and now this year we're at 236 in terms of members. The other thing that's interesting is that the cost for these same members that are 65 and plus, 10, 4, 11, 12, and then this year it's for 2025, it's down to 6,600. So you have fewer of them at a much lower cost basis. That's a positive thing. So one of the other reasons that I'm showing this data is to say, are any of the programs that we've instituted working in a positive way? So the first one that really is this Medicare education. The other one that I'll go to next is the GLP-1 medications. In the data that got released today by the Business Group on Health, they attribute specialty drugs and GLP-1s as the two top drivers that are causing this potential or this kind of expected of a 9% overall increase. Fortunately, as we mentioned before, we took kind of the evasive action, last year to stave this off. And we did see, as you can see, what happened in 2022 in the entire spend for GLP-1 was 867. Then it went to 1.899. Last year it was trending. Actually, if we hadn't made the changes, it would have been close to $4 million because we made the change in July. And this year it's at 836. So that was a really important, significant move that we were able to make that pivot to save. This is actually the report shared yesterday with us by Blue Cross Blue Shield as kind of by the pharmacy Prime Therapeutics. Just a couple of things that they kind of observed. The pharmacy benefit trend cost. This was for the January. Now this is a quarter. So now I asked them to give us a year to date, and they are going to provide that to us, which we'll send out later on. But just in a quarter review, the overall cost for the January pool is down 13%. The specialty drugs are actually down, from the prior quarter of 2024, or the same period, which is the second quarter. And then the traditional is down 19%. So those are some really positive things. Even though we have these higher cost claimants and some of the chronic conditions that are there, there's some good news that's occurring. And so the other move that we made is actually going to these specialty drug like the Accredo program and net results that we're moving to. Those are going to continue. It's like these counter moves that you always have to be ahead of. And so when we see this 9% forecast, it's really, it could be discouraging and daunting, but at the same time, we have to make these incremental moves to stay ahead of it. So what are the costs, especially trend drivers that they did observe though? Autoimmune is up, down 41% decrease, and cancer, the cost of some of these cancer medications down 34%. So they're in these categories here that they've identified. The traditional trend drivers, it's really the diabetic and weight management, and this is really attributed to both the Digby and the alternative medication availability. So they even on their data showed there was a 9% decrease in the diabetic class, which again that's in the Mounjaro, and Ozempic class, and then the weight loss class drugs, that being the Zepbound and Wegovy, they're down 65% showing in their data. So, anyway, that's the January pool that they shared with us. And then the October pool, just from a pharmacy trend, it's this PMPM, it's 0.29 below their benchmark. So in other words, it's aligning fairly close given age and sex demographics of the October pool. Trend is up slightly for October. So just again, compared to January, October is still trending probably more up, whereas January is trending slightly down. Here's the interesting thing about October that's really changed is the specialty medications are up 26% above the benchmark. And our trending is 15% of an increase. So that's really where, and again, I go back to, remember we showed you the plan richness comparison between October and January, where January or October still has those, like Hedinger that I went to, a zero deductible plan and a max out of pocket of 2,000. That's just not sustainable. And I know it's hard, but what was interesting in the conversation that I had with those teachers in administration is they got it. They understood that it's not realistic to correlate an inflation that we've had since 2010 at this, yet you kept your deductible and your out-of-pocket max at this since 2010. I kind of set the stage. It's like, expect changes. We have to make these changes. Especially trend drivers. This is the other non-categorized is $8.31. They didn't give a benchmark, or actually there was no spend in this category, so that's actually a new net cost. And then cancer, a 21.55 PM or a 23% increase over the prior period. Again, the weight management, they did see the major decrease, 57%. And then the migraine medications, they just identified that's kind of another one that had an increase, which was 59%. So that's what Blue Cross shared with us yesterday. So when we go back down to the ideas of, what can we do from strategy to keep at the forefront, we won't go into all the details, but some of the observations, this is the Springbuck data. There were 44% of the members identified that, and it represents 46% of the spend that still have gaps in care. So there's the preventative classification and then the chronic disease classification. And these individuals represent 46% of the plan spend. So what are those categories? I've shared these before, but the reason I keep this at the forefront again is we have to be thinking, okay, what are the drivers to the cost increases? But part of those drivers is the lack of proactive intervention to help these individuals so that they do know what they should do, when they should do it, and where they should seek care. This information is available. And again, at another time, we'll get into more of a drill down when we get in front of the insurance committee as to some strategy ideas. But I'm just bringing kind of a snapshot of what's going on for the board to see. And then again, going back to the section just on risk pool management, this is our control group, groups, I should say. We have 74 groups that have that this is identified in multiple sectors, so private sector and public sector, those that have really taken on these RPM strategies that we've been speaking to. It's focus on the change in the deductible and the out-of-pocket, predominantly on the out-of-pocket. That's really what our focus has been with most of these groups. We have a 10-year track record now with, so this represents 90,000 employees and 160,000 members that have been part of this control group that we made these changes. To give you some comparison, the national average, they're showing, it's been at 7.7 on the average for that same time period. For these groups in the control, 1.2% trend. That is massive. It's a massive amount of a difference, but also significant savings to those groups. But it doesn't understate the need and the effort to educate and to get groups to make these changes. But this is going to have an impact as we've observed some of the data and shared before. Some of your Medicare individuals, well, it's not going to be, if you make the changes to the out-of-pocket max, because those individuals still represent a pretty significant portion of the cost. Even though they represent less than 1% of the membership, they still drive 5% of the entire plan spend. Those 238 members that I shared earlier that are still on it, the plan, they're accounting for over 5% of the spend. So if the plan is too attractive, then they always come here. So as good as the Medicare education group is, it will always be on a comparative basis based on the economic value that someone is making on a choice for comparing, Medicare to to this plan or this plan or the plan that's offered compared to their spouse's plan. And then just the last section is just legislative updates. So we've gotten several questions, since this bill was passed by Congress. What kind of impact or what areas that it's impacting in the group health environment or just benefits overall. There were lots of sections to it, of course, but as it relates to the benefit section, the high deductible health savings accounts, for example, high deductible plans are going to be classified as bronze plans. So when we even come up with our programs, if it's a high deductible plan, we've seen, that they could still be a silver by richness value. And I'm not sure why they did this, but it's just, they probably tried to simplify it just by identifying all high deductible health plans as bronze. But we're going to just look at actuarial value when we show you data in the future, because we don't want this to get confused anymore, especially since they made this change. But the catastrophic plans will now be eligible for HSA contributions. It was a little bit iffy in the past whether they would qualify or not, but they clarified that in the bill. The permanently extend telehealth exceptions for high deductible health plans. This is actually a pretty significant benefit that was clarified in this bill, and essentially preventative and remote patient monitoring and some primary care services can be eligible for telehealth remote services at a zero cost share. That's actually a pretty significant change. Well, I should say benefit and clarification that went away. And then they actually retroed the benefit back into last year, or at the beginning of this year, I should say, for those that it sunsetted at the end of 24, but this all got reinstated for January of this year. Then they also increased if you're in an FSA program under a PPO, they've increased the amounts that you can contribute for employees or for individuals and families. Employers are allowed to pay for student loans beyond 2025 and make cost of living adjustments to the tax exclusion for the educational assistance programs. That's a positive thing. Allows employers to contribute up to $2,500 for a new type of tax advantage account for children. They call it the Trump account. It operates similar to individual retirement accounts where the earnings will grow tax deferred. And the annual contributions are limited to $5,000 per child. And then major Medicaid reductions in work requirements. This was a concern actually that when we looked at the data just to say, are you going to have individuals that could come back to employers plan who are eligible for Medicaid? Well, they made the qualifications work related and not health related, which was that's a really important clarification that I think most people, when they read the bill or were hearing about it, they weren't sure. They weren't trying to eliminate coverage eligibility for Medicaid because of a health condition that a lot of people could have lost coverage for, but it was for work-related hours. But it will impact that work-related requirement, and some people will lose coverage because it will require substantiation for work hours, and where historically it's not. And then the ACA and Marketplace Exchange, the premium tax credits that are coming for qualifying it's indexed based on income. That is probably could have some impact for individuals that could come onto the employer's plan in the future if they can't qualify for those subsidies that they've done historically. So that's the summary of the items that I essentially, where I took part of the, the components and the highlights of the bill that were related to the group health potential or the employer impact potential. Any questions on any of the items that I've covered? Nope. Well, that's essentially all that I had for updates to today, just to keep you apprised of what's going on, the progress we've made on some areas, and the work that we got ahead of us to make sure that we can stay below that 9%.
I'm always waiting, Randy, for you to say, I mean, there was some good news in there, kind of.
There were some little threads of little silver linings in there. Yes, there were.
Any questions for Randy and the report he provided? As far as the consolidation of plan design, I don't know if we need to, when we have another committee meeting or,
Yeah,
just
we were going to talk about that committee next time.
Yeah. Do we have a committee meeting date? Yeah. So we'll get
We
that.
don't. We'll get one scheduled. The committee was focused on the RX audit vendor. And so once we get that wrapped up, then we'll have a committee meeting, and then the next one will focus on the consolidation.
To clarify on that, then it's still a 2-year window that we're looking at. That's correct. So 2027 is when that is going to be the plan to be enacted. So I think it's just beneficial the sooner we can to start communicating with our employees and to ramp up, specifically those that are going to be, caught with a gap plan that doesn't cover prescriptions or whatever it is, and, have to do planning ahead. So, just curious on that, because we've even started to communicate with our employees about what might be forthcoming.
Yeah, I think the sooner we can, I mean, we maybe don't necessarily have those exact, whatever the 5, 6, 7 types of plan designs, but that idea that consolidation is going to happen. And I think we said, like you said, Steve, 2027. So it'd be helpful to have that fairly soon. So I'm not sure if I don't know. I suppose at the committee level, let's make sure we talk about that and get a game plan, some recommendations for the board to consider. Our next, I don't know if that's as soon as, the quickest could be the 3rd weekend of September. Is that, we talking more like October then? October meeting to have something that like that, a direction so that people can start talking to their groups?
I would say we could have the committee meeting probably in September. If we did the committee meeting towards the beginning of September, we could have something by the September meeting. I just know this is a really busy time of year for a lot of people, so I don't know I guess that would be a question if we want to try and get something scheduled that quickly for the committee to have for the September board meeting. As long as everybody's available, I think it would be realistic, but.
Might be too fairly quick, because I know, Angie, obviously with open enrollment happening in September, you're probably gonna want to get past that date to,
Yeah.
which I don't think that's too far away. I mean,
Yeah.
Okay. We'll get a game plan.
Yeah.
Thanks, Steve, for that. We've reached the end of our agenda. Do we have the next NDPHIT board meeting date and time?
Yeah, so it's because we now have the recurring one every month, so it'll be, in September, that 3rd Wednesday at 1. So that is on everybody's calendar. So now going forward, I'll have that Zoom link on a tab in the board minutes. So the Teams meeting is more as a placeholder, but we'll send you a Zoom link to actually join the meeting with the agenda each month so that we can live stream. I guess the one question I would have though, and I don't know if this is something you want to talk about offline, Mike, but now that we are meeting each month, is there anything specifically that we want to, are there topics that people want to talk about, or are there ideas of things to cover each month? Or just take it as it comes, kind of like we did in the past with agendas?
You guys have some insight on that? Anybody?
Well, I think there's so many things that we discuss on our subcommittee for items that need to be done. I think with the RX vendor audit and then moving into consolidations, maybe just updates on that. And then, I don't know, maybe taking a review on what the board wants the committee to work and then be able to go from there. Just a suggestion.
Okay. Sonia, you were gonna say something? Okay.
No, I was just gonna say, I mean, it's kind of hard to say what we want each month. I agree with Jenny, just what you guys are doing in your committee meeting, which thank you so much for taking the time to do, because I can already see advancement in just what you guys have done so far compared to, I mean, I know we're still new, but it's huge that you're doing that. So I think just what that committee brings, and then if something does come up that we have questions on, we can let you know a week ahead of time to throw that on. If something comes up on the schools, counties, cities, whatever, we can let you know.
And I think just to add, if you don't have anything on the agenda, we could just cancel the meeting for that month too. So take that liberty to, if there's nothing really to discuss.
Yep. Okay. With that, our next board meeting is on your calendar. I'll look calendar, September 17th at 1 o'clock on Teams or Zoom, right?
Yeah, it will be on Zoom, so we can stream.
Okay.
Sorry for the confusion on that one.
We're good. Do we have a motion to adjourn the meeting?
I'll make a motion and then I can challenge the board to everybody bring a new member to the next meeting. A new prospect that we could add. Just trying to help you out, Mike.
Yeah. Okay. That's a pretty hefty motion there. All right, we got a motion. Motion, we got a second?
I got a second, and I'll just piggyback on that. You educators got 59% increase in migraines in your school pool. Wow.
What
Must
happens
be,
in
must be those administrators.
Yeah. July and August, migraines start happening.
That was all in the last 2 weeks.
I'm probably 30% of the 60%.
Okay, we got a motion and second to adjourn. Everybody have a good day, good start of school if you're school people. See you soon.
Great, thank you.
Thanks, everybody.
Thank you.
So I'm gonna leave.